All right, we see a lot in the news about reductions in force. The director of the OMB, the Office of Management and Budget, has decided to go ahead and, well, Congress is, and the Trump administration has told him to go ahead and start firing people, laying people off. Potato, potato, right? So thousands of federal employees are going to be vacated from their positions. Thousands have already been in that situation since the takeover of Doge and Elon Musk. And so today we're going to talk about if that will affect your Social Security. And there's some people that it will affect your Social Security, and it's already being affected. And then there's a majority of the people that it won't. So we'll get into all those details today. So what we're basically talking about is Russell Vogt. And let's bring up a little picture of him so you know who he is. He is the Office of Management and Budget. He had that position before in the previous Trump administration, and he is one of the central figures of Project 2025. And he wrote down 2025 was a plan that was there, and everybody saw it. And so there was a lot of people saying, "Oh, that doesn't have anything to do with anything." But guess what? Over 50% of the Project 2025 project has already been implemented, and now they're going even further and implementing even more. And Russell Vogt basically says, we want bureaucrats to be traumatically affected. When they wake up in the morning, we want them to not want to go to work because they are increasingly viewed as the villains. We want their funding to be shut down. We want to put them in trauma. So this is the boss of federal employees. And yeah, I don't know if you ever had a boss like that, but he's doing a really, really good job. So they unleashed Doge and Elon Musk earlier this year, and Social Security has already been cut substantially. Let's come up with some numbers here. So, and this is nothing new. This has been going on to decades. This is for all those new viewers out there that are new to my channel. My name is Edwin. I ran the third busiest Social Security office in the country, so I know a little bit about how Social Security works and how people get benefits. Also got it. This is a live Q&A. I'll talk about the cuts and how that could affect you for about another 5 or 10 minutes. And then for the rest of the hour, I will answer any and all of your questions. Already got people talking about, Rachel wants to know what she should do. Her husband passed away. People asking about SSDI at 59. Got another person talking about their PPO plan, their Medicare Advantage plan was canceled. So I'll get into all those answers here in a bit. But this has been a long time coming, for decades. Politicians, pretty much on both sides, one group of politicians really want the government to not exist and give all that power over to corporate America, which power hates a vacuum. If one particular entity, that is our duly elected representatives, don't have the power, then it goes somewhere else. And in this case, it's going to go to corporate America, Wall Street, equity, all the rest of it. So that's their intention. And the other party just, I guess, is incompetent and didn't do anything, or perhaps they have ulterior motives that they want Social Security to be privatized. So the goal is to make Social Security customer service the worst it possibly can be, to prevent you from getting your benefits. And so you will hate Social Security, and that way when they start cutting checks, which way they will cut checks, and another 87 checks, you're going to get your check for another 87. But as according to the Social Security Trustees report, your 88th check is going to be cut by 23%. And what we probably is going to see happen is probably a month or 2 months or 5 months or 10 months before that. So when you're down to, when this number is down to 7 or 10 or something, then the politicians are going to come in there and say, well, we tried nothing and we're all out of ideas. So I guess we just have to give it over to our buddies on Wall Street and privatize Social Security, which was the intention the entire time. But anyway, but in terms of what's going on right now with the cuts, if you are currently receiving a Social Security check, as of right now, these layoffs, let me put this on, these layoffs only look to be affecting Treasury, Health and Human Resources, Commerce, Education, and Homeland Security. It is a fact that Treasury, those are the people that actually cut your Social Security checks. So how it works is the Social Security Administration tells the Department of Treasury is the giant, checkbook for the government. So the Social Security Administration tells the Department of Treasury, here, cut the check for Naomi or Nona or Javier or GC or whoever. And then the Department of Treasury goes ahead and cuts that check. They're going to be massive cuts to Treasury, but this is all an automated system. So if you're currently receiving a Social Security check, your benefits won't be affected as of right now. However, if you are about to file for benefits, if you have filed for benefits, particularly those people that have filed for disability benefits, everything is going to be delayed even more, because when you file for disability benefits, you file at your local Social Security Administration, and then staffing is very, very, very low. So it's going to take a time for them to work your system, get you in and everything. And then they send that file to DDS, which is a state agency, and they're the ones that make the medical decision. So, and they are being cut back substantially as well. So even though DDS is a state agency, it's funded by the Social Security Administration. And when the Social Security Administration has low funding and they're not able to even, take care of their own employees there, then unfortunately that gets cut on that side as well. So yeah, we've got a lot of questions here about all of this. So there's a lot of social media out there that are, doing the whole scare tactics about your check is going to stop or anything like that. As of right now, no. I'm going to keep an eye on this. I'm going to give you some tricks if you're currently filing for benefits. People say, well, I filed online, it wasn't an issue. But remember, even when you file online, an employee on the other side has to confirm, has to check, has to review your application to make sure everything is correct. Make sure you don't have any scrambled earnings, any gap years, any spouses, child and care benefits, any other issues that need to be addressed. And if there's no employees on the other side, unfortunately, we see people getting the incorrect payments, not getting all the benefits they're eligible for. And this is the reason I do this live Q&A pretty much on a daily basis, to make sure you're getting everything you're eligible for, you and your family. And so, Russell Vogt, he is also, this is going to affect. So people say, there's some people out there and says, oh, government employees, who cares if they fire them all? Okay. All right. So if that's your, that's your view, then okay. But he is also going to be in charge of the massive cuts to Medicare. And you're like, no, it's not Medicare, it's Medicaid. Yes, Medicaid is going to be cut close to $1 trillion, which there's going to be tens of millions of people kicked off of healthcare, and they're going to go to an emergency room, and prices are going to go up for everybody. That's established fact. But they're also going to be close to or over $500 billion in cuts in Medicare. Medicare, that's the Part A, Part B, and all the rest of it. And that one already started. And why is that? And people are saying, but cuts to Medicare aren't in the big, beautiful bill. Exactly, correct. But neither is the suspension of the PayGo Act. The PayGo Act is an act that has been around for a long, long time, over a decade. And it basically says if Congress is fiscally irresponsible and passes something that causes a lot of debt, they automatically have to find cuts in other places. So they already did this. They cut Medicaid. They've cut the Affordable Care Act subsidies. That's why the government is shut down right now, in order to give trillions of dollars to the super, super wealthy and businesses. So they were able to offset the tax cuts, which predominantly, yes, we get a few crumbs too, but the majority of the tax cuts go to the super wealthy and the corporations. And in order to pay for those, the vulnerable, those people on Medicaid and those people getting subsidies from their health insurance, have to pay for it because, they need a new yacht or private jet or whatever the case may be. But it wasn't enough. They didn't cut Medicaid and health insurance for the poor people enough. So they need to find other cuts. And that is where the PayGo suspension, the PayGo Act comes in. It says that, hey, if Congress doesn't do their job and finds cuts other ways, we're going to do it for them. And how does that work? It's basically that they put a person in charge, and guess who they put in charge of finding those cuts. So about over $500 billion of cuts have to come from somewhere. And there's a couple of places that are exempt. Social Security Administration, they can't cut those billions of dollars from Social Security. That's exempt. And Veterans Affairs, they can't cut it from there. And the third largest program out there that they can cut is Medicare. So that's why we're going to see over $500 billion in cuts to Medicare over the next 10 years. So we're talking about, $50 billion a year. So that is already going to start. We haven't seen it trickle down yet. So this is probably going to be less money to like Medicare Advantage plans, Medicare Part A, Part B. Less people are going to take Medicare. They're going to, go for private insurance or whatever the case may be. And it's even more important now than ever to make sure, your Medicare is squared away. And one of the first questions we have here, let's go ahead and jump into one of the questions here because this fits in perfectly. Paul says, my insurance provider discontinued my PPO. Plan G, after the initial $257, will I still pay the $185 for Part B? Yes, everybody pays the $185 for Part B. So what this is Paul. Paul is one of a million. You're one of a million, one in a million, Paul. It's estimated that I think it's close to a million. I think it might be a little bit over a million people this year are losing their Medicare Advantage PPO plans. Why? Because these health insurance companies, they are in, as Ari from Chapters, Ari from Chapter is going to be joining us next week on the 15th, but he always says these health insurance companies are in either one of two phases. They are in the expansion phase where they're trying to get as many people to sign up for their plans as possible, or they are in their margin phase where they want to make as much profit margin as possible. And guess what? In 2026, they're in their profit-making phase. They're cutting people back. One company is cutting over 600,000 people because those PPOs cost more money for them. So they don't make as much money on a PPO versus an HMO. That's more highly monitored, where they have, contracts with doctors and hospitals. And you have to use in-network. With PPO, you can use out-of-network, but it costs you more, it costs them more. So they're canceling a bunch of PPOs, okay, close to a million. So for those people that have been canceled for whatever reason, you have a golden ticket. Make sure, Paul, you keep that letter. And in that letter, in the bottom of it, it says, now you have a guaranteed issue. You can get a guaranteed issue Medicare supplement plan, either a Plan G or a Plan F. And the only way you can get a Plan F is if you were eligible for Medicare before January 1st, 2020. So you're talking a Plan G. You can't get a Plan N with a guaranteed issue. But yes, a Plan G covers all of the gaps of original Medicare, except for the Part B deductible. So it covers this deductible, it covers this, it covers the 20% there, but the only thing it doesn't cover is the $257. So if you have $1 million operation, Paul, then you will pay $257. But you'll still have to pay the $185 because in order to get a Medicare Advantage or a Medicare supplement plan, you have to have Part A and Part B. So yes, you'll still pay the $185. The only people that don't pay, well, everybody pays the $185. Some people get the state to pay for that $185 for them. So if you or your family or someone you know are having a hard time paying for the $185, tell them to reach out to Medicaid and apply for Medicaid. And if they're eligible, the state will pay for their Part B premium, that $185. And then there's another program that'll help. It's a Medicare Advantage Part B give back. So Paul, you're kind of stuck unless you can get Medicaid to pay for that $185. But there's a Medicare Advantage Part B give back where the Medicare Advantage plan pays for part of your Part B premium, $50, $100, $185 or whatever. It depends what's available in your particular area. They're all area specific. So, all right, let's see what else we got there. Lisa, got letter today. State now won't pay for my Medicare. They will deduct 2 months next check, then $185 going forward. Cuts are starting. Lots of people are going to feel the pain. Yes, that is a fact. And it's they played the trick. The trick now, there's 5 words that are abracadabra, that are magic words nowadays that politicians can use to distract us so they can do anything they want. Fraud, waste, abuse, illegal aliens. That's it. If they mention any of those 5 words, we're completely distracted, and we don't know what to do, and we just let politicians do whatever they want. And so that's exactly what they're doing right now. So yes, this is going to happen even more. Medicaid, and they were talking about, we're just going to make people go back to work. Okay, that's only about 3 or 4 or 5% of the total budget. But the other 97, 96% of the $1 trillion is going to be felt by everybody else. So there's going to be a lot of people that are eligible for benefits that are going to lose it because states aren't going to get that money, and this is going to happen a lot more frequently. So we're coming up with a project to help with that. But Lisa, yes, unfortunately, number one, Lisa, number one. This, I just showed the video, but I forgot, bureaucratic disenrollment. So this is going to happen a lot. I think the state of Utah, they did the analysis of the state of Utah that 90% of the time, the state of Utah does a bureaucratic disenrollment where people are actually eligible, but that particular state, and a lot of states, Utah is the worst, they just make it so difficult and make you jump through all these different hoops that's almost impossible to jump through in terms of bureaucracy that you lose it. Even though you are eligible, but you lose it because of all the bureaucracy. And that's bureaucratic disenrollment. But you have to fight that. So number one, Lisa, please fight it. If you disagree, if you say, no, I am eligible for Medicaid, whatever calculations the state made, if you disagree with them, make sure you appeal that decision, okay? But if you did that and they still said no, then unfortunately, yeah, you're going to lose, you're losing your Medicaid, or they are downgrading you. If they're downgrading you, then because there's different levels, there's QMB and Slim B and QI and different levels. But if you're in one of the higher levels, you get your Part B paid, the $185. If they downgrade you, then you might not get it. If they downgrade you out of those, basically those 3, depends on the state. So you might still have Medicaid, but they're not paying your $185, or you just don't have Medicaid at all. So number one, fight it. And number 2 is that if you have had a Medicare Advantage dual eligible plan, then you're going to lose that one as well. Because in order to have a Medicare Advantage dual eligible plan, you have to have dual. And dual means Medicare and Medicaid. So if you've now lost Medicaid, you're no longer dual. So you also have to get a brand new Medicare plan as well, a Medicare Advantage plan. Under those circumstances, if you lose Medicaid, you probably can't get a Medicare supplement plan. And in your case, you probably, because there's a monthly premium for that. So that probably won't be a good option for you. So you just need to get a new Medicare Advantage plan. Reach out to where it is, chapter there, and they will definitely help you out. So, all right, let's see. Yeah, a lot of people cutting out. All right, yeah, in and out. Huh. Yeah, some people are having no issues whatsoever. Other people are. So we'll see. All right. Okay, so there was also, let me see, another question here. Someone lost their husband, and the person is 70 years old and wants to know what to do next. If you lost your husband, number one, you get that $255 lump sum death payment. I know it's terrible. If you were married to someone and they passed, you're eligible for that $255 lump sum death payment. And it's been like that for decades. That's one of the reasons we partnered with a dig agency. If you're looking to really protect your loved ones after something happens to you, then you can reach out to them and they can help you with burial insurance. But number one, you get the $255. And number two, it depends how much your benefit amount is. If your benefit amount was even $1 less than that person's, your deceased spouse's benefit amount, then you should be eligible for benefits on their record. Okay. So, and you said you're 70 years old, so you definitely need to file for those benefits. So this is not an automatic thing unless you have already been receiving benefits on that person's record. So if you are receiving benefits on somebody's record, I'm trying to check my audio here and make sure everything is good. I think, yeah, a lot of YouTube, a lot of issues with YouTube recently. The audio is not great in lives. So anyway, but yeah, it all looks good on this side. Okay. So if you're already on somebody's record and they're the higher earning spouse, and so already on their record, that means you're already receiving spouse benefits on that person's record. Then if something should happen to that person and you're beyond your full retirement age, then you're what's called an auto convert. Your benefits are automatically converted from a spouse benefit, a living spouse benefit, to a surviving spouse benefit. That's 100% automatic. And then if your addresses are the same, then they also release that $255 lump sum death payment. If you're under your full retirement age, then Social Security contacts you, or you contact Social Security, and because you have to have, you can wait to switch to survivor benefits until your full retirement age to get the full benefit amount. But if you're already past your full retirement age, then it's automatic. So it sounds like the person that left the note was not automatic. So that means you weren't on that person's record. So you need to contact Social Security and file for a surviving spouse claim. So let's see here. All right, other people are having no sound issues there. Perfect. I will be homeless if that happens to me. Oh my God. Yeah, if you're, because when you lose, there's going to be so many people hurting, because there's going to be massive cutbacks to Medicaid, because again, the whole fraud, waste, and abuse. Oh, there's a bunch of 26-year-olds, able-bodied people, sleeping in their parents' basement playing PlayStation all day, and so we're going to kick all those people off. Okay, fine, perfect. Okay, no problem. But that only makes about 3 or 4% of the total budget. So you say 3 or 4%, but you've cut $1 trillion. So where are the other 900 billion going to come from? It's going to come from everybody else. So states are getting a lot less money, and they're going to start kicking people off of Medicaid. So when you lose Medicaid, you lose Medicaid, then you've lost the $185. So you're going to be charged $185 more. And then there's another law that ends this year, VBIB, which is the one that a lot of people got those grocery card, the over-the-counter cards, and people were getting $100, $200, $300 from them every month. And that program goes away at the end of this year. So a lot of people have been contacting me and coming to live Q&A and says, hey, they cut back my grocery card, my over-the-counter card. It was $200, now it's $50. Yeah, that's because that thing's going away. There's another program, but it's a lot less generous. And you have to jump through a lot more hoops. You have to have a chronic disease, and the health insurance company has to go through a bunch of stuff in order to get you that over-the-counter card. So yeah, so people are going to lose, the $185, and they're going to lose their grocery card, which a lot of people depended on. And then if they're going to lose all that cost savings for the Medicaid that paid the extra premiums and and the co-insurance and the co-pays, and helped with prescription drugs and all the, so it's, but billionaires are going to get a humongous tax break. So there's that. So I signed up for my Social Security in April at 64. I will be 65 December. I received my Medicare card already and just signed up for Medicaid. Is there anything more I need to do? Yeah, you need to, okay, so you signed up for Medicare and Medicaid. So now you want to see the only option you have is a Medicare Advantage plan. If you have Medicaid, you can't sign up for a Medicare supplement plan. So you just need to see if a Medicare Advantage plan is good for you. So you can reach out to Chapter and see if there's anything available where you can get some extra benefits or something like that. But if not, if there's nothing better that will improve what you got in your particular area, then you're good. So, and remember, if you just signed up for Medicaid, and if they approve you at the higher levels, then they'll pay for your $185. But if you've already paid for the $185 out of your Social Security check, sometimes it takes a little time for those three systems to work together, Medicaid, Social Security, and Medicare. So you might pay double for a month or two. You've already paid, and then Medicaid's going to, they will reimburse that. As soon as the system realizes that you paid twice, or you paid for 1 month or 2 months, and then Medicaid reimbursed for that 1 month or 2 months, then they will put a credit on your record, and then they'll release it. That's an automatic thing the computer system does, and it works 99.9% of the time. So just keep an eye on it. Make sure you get that $185. Hey, $185 is, especially if it's twice that. How are the cuts to Medicare going to be achieved? That's a good question. Will there be illnesses that are not covered? Will they cover a lower percentage of the cost of tests, treatments, or both? That is what the jury is still out on. You've already seen that they're starting to do prior authorizations in some states. 6 states they've chosen to do prior authorizations for original Medicare, which is pretty much, never existed like that before. The only prior authorization they had in Medicare before original Medicare Part A and Part B is it had to be medically necessary, right? So dental work, no, but you need dental work because you got a car accident and therefore you had your jaw messed up, and then dental work, that's medically necessary because it's part of that jaw restructuring type thing. Male pattern baldness, not medically necessary, so that will be denied. So. Come on, guys, let's make that change. But guess who decides? Guess who decides? Our good friend there, Russell Vogt, architect of Project 2025, and he doesn't want any of it to exist. The old thing, he wants to make the government as small as possible so they can drown it in the bathtub. And people say, "Oh, I hate the government. I hate the or they don't say it like I hate the government." I went to high school in Texas, so hey, what are you going to do? But the alternative, again, power hates a vacuum. So if you take all of the regulations and all that, we hate regulations, we hate paying taxes, If you take that all out of the government, out of our duly elected representatives, and then where does it go? Then corporations can do whatever they want, which pretty much they already bought politicians now. So, but it's getting even worse. Well, will Medicare stop covering pre-existing conditions? As of right now, no. The American health care system is, particularly how we pay for our health care, is just the most confusing in the world. Original Medicare Part A and Part B and Part D, the prescription drug plan, no pre-existing conditions. That's not even an issue in pre-existing conditions. Anybody can sign up. Doesn't matter how sick you are when you turn 65 or whatever the case may be. Medicare Advantage, no such thing as pre-existing conditions. If you're eligible for a Medicare Advantage plan, doesn't matter how sick you are, they don't ask any questions. You can sign up for a Medicare Advantage plan. The Affordable Care Act, regular private insurance, based on the Affordable Care Act, they took that out. Remember the old days that we used to see all the time? Some 10-year-old little girl got this terrible disease, and they try to get health insurance and the health insurance denied them, or they try to get this coverage and denied and stuff. The Affordable Care Act ended all that, so we don't hear that anymore, luckily, but that might be coming back here. But the only thing that can deny you for pre-existing conditions is if you want a Medicare supplement plan outside of a enrollment period. So when you turn 65, Medicare supplement plans can't deny you. They can't charge you any extra. If you're new to Part B because you didn't get Part B at 65 because you were working, then they can't deny you. But other times they can deny you. In some states you can't be denied. Yeah. So as of right now, Medicare pre-existing conditions, there are prior authorizations that are starting. Yeah, hopefully we can do something about that. I had cataract surgery, successful. Great. Now having refraction post-cataract surgery with a regular eye doctor next month. Had well paid after my copays getting dropped December. Oh, okay. So yeah, so you need to find something else. If your plan is one of those that are dropping you, then you definitely need to find something. And I said this last year, there was about half as many people that got their plans dropped. And we tried to reach out to those people and say, hey, you need to get something, a lot of people don't read their letters when it comes in. They don't understand it. They have the same Medicare Advantage plan for 2 or 3 or 4 years, which they don't. They're only good for 1 year. But anyway, and they, say, well, I never did anything before, so maybe this is just, scam or something like that. So they throw it away. And then they go into their doctor in January, and the doctor says, you don't have health insurance. And they're able to sign up at that time, but if they have to go to a doctor and get prescriptions or they get an injury or something like that, then yeah, they don't have health insurance for that month. Their health insurance won't start until February. And we had a lot of people this last year that ran into that because they didn't do what they needed to do. And I think we're going to get 2 or 3 times that this time as well. So let's reach out to everybody and make sure everybody's squared away. Lori, Jerry, yes, you will be penalized a lot, and it is for life. Plus, you will have no insurance. Health isn't promised. You need insurance. Yeah, insurance sucks. Particularly having insurance for health makes, no sense to introduce a profit-driven company to get in between you and your doctor, but this is our reality. So, can someone tell me if Project 25 includes cuts to VA non-medical support staff? I heard Dr. Ed said there's a planned exemption for VA, but they already lost a lot of staff. Yeah, yes. The exemption is based on this, the one big beautiful bill, the big beautiful bill for billionaires, that the PayGo exempts the VA under that particular program. But the VA has already been taking massive cuts under separate programs, under separate cutting programs. So yeah, the VA unfortunately is not safe. And a lot of veterans, they're going to be in a world of hurt because I'm an old Marine Corps sergeant, so I always try to look out for veterans as much as possible. And veterans, up until now, they're like, well, I'm using the VA. We're not talking about retired veterans that have TRICARE. That's completely different. Like I only spent 8 years in the Marine Corps, which is 20 years in all other services. But anyway, so I'm not eligible for TRICARE because I didn't retire out of the Marine Corps. I would possibly, I'm not, but could possibly get VA veterans and work, get my stuff done at the, local VA clinic. And there's a lot of veterans that do that. And because they were happy with their local VA services, they refused Medicare Part B because they didn't want to spend the $185, which makes sense. Why spend $185 when I don't need Medicare? I can get my stuff from the local VA, which, okay, good. But now things have changed. And now there's massive cuts and even more cuts, probably not based on the PayGo, but other cuts to VA services. And those people that don't have Medicare Part B don't have Medicare Part B. And so they don't have a fallback position. They can get Part B But number one, they have to wait till the general enrollment period, which is January, February, March, to sign up for Part B, and they will be penalized 10% for every 12 months they did not have Part B and Part D. Part D is 1% penalty per every month. So if you or your friend who's a vet, realizes, oh my gosh, the VA medical system is really deteriorating. I can't get an appointment. There's no staff there. But I still need medical care. I guess I need to go back and bite the bullet and get my Medicare Part B and get a Medicare supplement plan or Medicare Advantage plan or whatever the case may be. Sorry, you can't do that until January for the most part. January, February, March. If you do it in January, your plan will take effect February 1st. If you do it February, it'll take effect March 1st. And you're going to pay 10%. So if you waited 5 years, that's 50%. 50% of what? 50% of the $185. So you're going to pay $185 and half of that. So please reach out to your veteran people and, tell them to come here and ask questions, and we'll see what we can do. I am to be getting money from the Dixie Fire. I'm on SSI. Will that cause me to lose my SSI, or how long do I have to spend it? How does that work? Please help me. I'm 72, disabled with MS. Oh, is that the Dixie Fire in Utah there? I think it was Dixie. Or is that the mountains of Arizona? Anyway. If you're truly getting SSI, supplemental security income, which is the welfare-based program, low income, low resources, then yes. If you're getting any other type of Social Security benefit, it doesn't affect it whatsoever. But if you're getting SSI, yes, it will affect it. You can have kind of a spin down type thing. And if you're getting compensated because of a fire, because something in your home was destroyed, then you're getting that money because, something in your home was destroyed. So you probably need to fix something. So if you do a spin down almost immediately, then it won't affect your SSI. So just contact your local Social Security office, talk to a SSI CS and say, hey, here's the deal. It's a SSI claim specialist, and say, here's the deal. I'm going to be receiving X amount of money for compensation. And when I get that money, I am going to use it to do what I need to do to my house. Or I already did all of the repairs, and now I'm in debt and I have to pay all that back. So then that's basically a spin down as well. So definitely reach out to them. So you might, you might lose. It depends how it all works out and everything, but you might not get SSI for 1 month if you can't do the spin down soon enough. But that's just you just won't be you won't be eligible to get 1 month benefit because you're over resources. And then once you get those resources down to under $2,000 if you're single, or $3,000 if you're married, then it won't be an issue. So. Let's see. People need to pay their rent or mortgage, pay their electric and water bills, buy groceries, etc. Get it together. Stop stomping on the poor and lower middle class. Yes. I think with AI and robots and sending jobs overseas, they just don't need us anymore. Back in the 50s and stuff, when they needed a labor force, they were super, super nice, but now they just don't need us anymore. So, I saw a video of Vote well over a year ago before the election. I saw a video of him sitting on a sofa gleefully describing all the pain he was going to put Americans under. Yeah, that's where that interview comes from, about he wants to traumatize, the federal workforce, the people, civil servants, the people that help you, and sometimes they're, not the nicest. Yes, I understand. But in terms of Social Security, their ultimate job is to make sure you get all your benefits out you're eligible for. And I did a video, it was about a year ago now, and the title, the thumbnail is Social Security employees don't care about you. And got a few, I'm going to have to do that video again. But basically what it is Social Security employees don't care about you. Because I hear all the time, I went into the office and the person didn't like me. They didn't like where I was dressed, or I was wearing Crocs, or didn't like the color of my skin or my accent or something like that. And therefore, that's why they didn't, give me the benefits I was eligible for. And That could happen, but 99.9% of the time, they don't care about you. In a good sense, they care about you, but they don't care about you like that. They care about not making a mistake. Because in Social Security, when you're hired for at Social Security, there's over 20,000 pages of policy. And they always tell you, I used to tell my staff when I hired him, it says, if you do things right the first time, you'll be done in no time. 10 minutes, an hour, or whatever the case may be, whatever you're working on. But if you make a mistake, it takes you 10 times longer to fix that mistake. So if you want to make your life as easy as possible at Social Security, do things right the frickin' first time. Because if it's not done right the first time, then someone's going to find it. The person that's usually receiving the money is going to come in and after a month or two and say, hey, I'm not receiving the benefit amount. And guess who we are going to make sure fixes it? And then we're going to review to make sure you fix it right. We're going to make you do it. So if you want to make your life easier at Social Security, do it right the first time, because to fix it takes 10 times longer. And so self-preservation at Social Security is, they don't care about you. They just want to make sure they don't make mistakes. So to make their life easier. If they make a mistake, it makes their life harder. So I'm gonna have to do that video again, probably. Yeah. And again, he is not stopping at federal employees. He is going to Medicare. They've already cut Medicaid, Section 8 housing. Section 8 housing, I think, has taken a 43% cut. So Section 8 housing was already years. You have to wait. The waiting list was already for years, and now it's going to get even worse. They're going to be kicking people off. If you're elderly, you've probably heard for Section 8 housing, they're going to have a 2-year time limit. That it's exempt for if you're elderly or you're disabled. I think those are the 2 exemptions. That you don't have that 2-year time limit. But if you're able-bodied, whether you've got children or anything like that, you're a 2-year time limit. And because they're cutting the budget for veterans as well. So if 43% cut in the budget, so there's going to be a lot less vouchers out there, and more people are going to be homeless, unfortunately. But hey, the billionaires, they're going to get a new yacht. So maybe they'll give us a ride. Liar. I just got extra in October, including an entire package from the state I reside in. Pre-existing conditions. I've been signed up with Medicare from Brooks Army Medical Center. Okay, not sure. Got extra in October, including an entire package from the state I reside. Not so what kind of package you're talking about. Signed up for Medicare from Brooks Army Medical Center. Yeah, you don't sign up for Medicare from Brooks Army Medical Center. You sign up for Medicare at Social Security. So not exactly sure there. If you could, if you think something I said is incorrect, please just write it down there a little bit clearer so I can understand. Medicaid dropped us because we made $300 too much when she came on disability. But Medicare and my Advantage plan says I still have Medicaid associated with SSDI and Medicare. So they probably downgraded. So that probably, so if your Medicare Advantage or whoever, your broker, whoever, because they can look in the system and see if you're eligible, probably they just downgraded you because you made $300 more and you weren't eligible for QMB, Slim B, the QI, the higher levels of Medicaid. And so you probably still have Medicaid, but the lower levels, and maybe you have some cost sharing and stuff like that. So, but remember, definitely check your plan. And in order to prepare to check your plan, here's what you need to do. I call it the 6 Ps. So that between October 15th and December 7th, you can change your Medicare Advantage plan. And to do it, doesn't matter who you use, you can reach out to Chapter. They're awesome. They've got customer service all year long. But here's what you need. You need your current plan so you can compare apples to apples. You need your providers, the names of your providers, so you can say, hey, I don't care what plan I get, but I got to have these particular doctor. This doctor has to be covered. This hospital has to be covered. And then your prescriptions, your dosage and everything like that, have that readily available. so you can save as much money and make sure that your prescriptions are part of the formulary there. If you have a particular pharmacy you like to use, make sure you have that name there. And your priorities: need more dental, need more vision. You know, you've got to save as much money on hospitalization or whatever the case may be. And that's 5 of the things. The number one thing is to make sure you're in the right plan. And then number 2 thing is persistence, to make sure that the other 364 days of the year that you're fighting for all of your benefits, because as I mentioned, they are in their margin phase, their profit making phase, and they're going to try, these health insurance companies are going to try to make as much money on you as possible, but denying you and making it difficult and putting up all the bureaucratic hoops. See, bureaucracy, you know, it's not only it's not only the government. So they're going to do everything they can to get as much money they can from you. And you're like, they don't get any money from you at 0 premium. No, they get about $1,000 a month. A lot of people don't realize that. If you sign up for a Medicare Advantage plan, the government pays them. If you're just an average person in average state, the government pays them $1,000 per member per month. So the government pays whatever health insurance company, a Medicare Advantage plan you're signed up for, the government gives them on average about $1,000 a month. And if you don't use it for the entire year, they just made $12,000 of profit essentially. If you're healthy, they get paid less. In some states and some counties, they get paid less because it's cheaper. And if you have a lot of multiple conditions, if you're very sick, they even pay more. And where's that money come from? From your pocket. All those decades you pay into medical part B or part A, your $185, general taxation. So we paid for it. So persistence, get that money back. You paid for it. That is your money. Get it back. So the number one thing to do is to get the right plan. And number 2 is to make sure you get it all back. So let's see. Cory Burker said, keep calling lawmakers as Bernie Sanders, AOC, et cetera. They're acting all this to call Capitol switchboard and write emails of how healthcare is going to affect you. Absolutely. Yes. So, I mean, it's a participatory democracy. So reach out to your politicians on anything, how the cuts to Social Security, or you can't get through Social Security. So that's the thing. And don't fall for those 5 abracadabra words: fraud, waste, abuse, illegal aliens. You know, as soon as they say that, they, you know, thanks, Dr. Ed. Doesn't seem fair, especially for vets. Yeah, it's the VA healthcare is definitely going to be diminishing. Yeah, it's going to hurt. Will online help be available to establish a new Social Security account during a shutdown? Just got a new phone and had to cancel and acquire a new account last time. Leaving the U.S. soon and need an active account. Yeah, AlphaCAD. Social Security is part of essential services, so they still work during a shutdown. There's a couple of things. There's a few workloads that are not allowed to do, getting a new Social Security card, or excuse me, a replacement Social Security card and stuff like that. There's exceptions there. Work histories for background checks and stuff. There's some things that they don't do during a shutdown, but your particular case, they'll help you out. It'll take forever, possibly, or maybe get lucky. People say, no, Ed's lying. I just called up and it took me 5 minutes to get in. Well, tell us which office and we'll have everybody in the country call that office, because it sounds like they've got some employees there. So let's see. My sister has a company. She said 2026, it will not be covered by Mayo. Wow. Yeah, the Mayo Clinic. So if that's the facility she likes going to, she goes to on a regular basis, and that particular company doesn't cover it anymore, then she needs to find another company that will cover Mayo. As a 60-year-old SSDI recipient, I now have to transition to Medicare on November 1st, but my Medicaid is going to be pay part premium. Okay, good. I was told it might be possible to qualify for supplemental too. Okay, so you have had SSDI, Social Security Disability Insurance, for the past 24 months, and then it'll be your 25th month. You're signed up for Medicare automatically. So you've had disability for 2 years. So yeah, so you have already had Medicaid, and now your Medicare is going to kick in November 1st. So you are eligible, depending on your level of Medicaid, you're eligible for perhaps a Medicare Advantage dual eligible plan. Those are the ones, that cover the most and have the most benefits generally throughout the country. But if you're not in the higher levels of Medicaid, then you can just get a regular Medicare Advantage plan if there's one in your area that you like. So you can reach out to Chapter there. Since November, if it's November 1st, I would probably call them like immediately, like right now. I would, because starting October 15th is when everybody in the country is going to start, calling them. So you don't have to wait till October 15th. You can see if a Medicare Advantage plan, if there's a good one in your area, you can do that now and get signed up. And that way, if you get signed up today or tomorrow, then your plan will start November 1st. So the same month as your Medicare will start. So yeah, I would call them. It's 3:51 Saturday on West Coast. I think they're still open. Yeah, the chapter is going to be Monday through Friday from 8 to 10 East Coast time, and Saturday and Sunday from 9 to 9 East Coast time. So yeah, they're going to be working some crazy hours. But right now, yeah, do it before the 15th, because starting the 15th, it's going to, I would do it now. Get it over with. Beat the rush. Except in Nebraska, you'll be billed later. So. Right to your term limit. They're looking at elderly and seniors are protected. Also, I have said on this channel, the way to avoid the long wait list is to go to a new construction at affordable. Oh, okay. So you're talking about the Section 8 housing. Yeah, yes. Yes, she gave a recommendation for Section 8 housing vouchers that you can go to new construction areas that are building affordable housing and then work it out there, and you might be able to skip the list a little bit. They also have pocket listings and pocket vouchers that, all of a sudden, it's all about timing a lot of times. That, there's a 2-year wait for your voucher, but someone gets one and they don't use it and they need to use it immediately, and you just happen to be there at the right time, and yada, yada, yada. So, yeah, you need to keep up on it. But feminine, sounds like you're up on the whole Section 8. You've probably seen it as well, that there's going to be a 43, based on the one big beautiful bill, about a 43% cut to those vouchers. Well, it's not only to those vouchers, to HUD, the housing and urban development across the board, a 43% cut. So it's going to be tough. So, let me see. I'm retired and I want to live in Africa for a while. I have my bank accounts here in the United States where my Social Security has been deposited. I want to know if money is secure. Yep. Other than, they run into the bank or something like that. But in terms of Social Security, no, you're good. So unless you're receiving SSI, the welfare-based program, but if you're receiving survivor benefits, disability benefits, retirement benefits, spouse benefits, you're good. So no problems whatsoever. Enjoy your trip. Let's see. Yeah, that's who I checked with Chapter. My company said I don't have copay, and providers said yes. Oh, okay. Don't have copay, and providers said yes. Oh, I think someone was mentioning yesterday. Yeah, their providers are charging them, and then they're getting charged a second time. And that's one of the reasons why my son and I chose Chapter to help out, because a lot of Medicare people that help you out there, there's tons of people out there that can help, but a lot of them just sign you up and then they forget about you. Chapter has a member success team, and we had the person in charge of their member success team, and they help you fight those prior authorization and help you get, your formulary exceptions. If you're finding a doctor and you're getting weird billing, they help you out with that. And so they provide all those extra services. So that's, if for no other reason, that is a good reason to go with someone like Chapter that is able to help you out. And again, full disclosure, they support this channel. They support this live Q&A. They are supporting, our new website that are going to be helping people out with Medicaid and food stamps and Social Security, disability, and everything. So, so it's someone in the early comments said there's a Robin Hood situation. This is a Robin Hood situation. Here's the Robin Hood situation we got going on. Is that you call Chapter or you call our other affiliate there for the burial insurance. You can call them too and get a quote and see if it's good for you. And so these are insurance companies. So burial insurance, health insurance, Medicare, these are giant multi-billion-dollar health insurance companies. And if you find one that you like that's good for you, then you sign up for it. And those health insurance companies pay those particular entities, those two entities right there. And because when you called, you say, hey, Ed told me to call, then they throw us a few bucks and we take that few bucks and we put it into our live Q&A and we put it into our new website, which is very, 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 very close to being done now. And yeah, so we're going to be helping out tons of people, y'all. Yeah, in terms of all this. So we've got these big health insurance companies helping the most vulnerable in America, and they don't know it. Please don't tell them. If they find out they're doing something good in this life, then they might have an issue. Can I claim retirement benefits from my husband's Social Security if he hasn't retired yet? Married 41 years, was a housewife, didn't work for 31 years. No, because you said my husband. So I assume he is still your husband. If he's still your husband, then he has to file first before you can start benefits on his record. So you can start benefits on your record, but then when he files, then you can file for spouse benefits. If he is your ex-husband, then yes, as long as he is at least 62 years old and you've been divorced for 2 years. It's called independently entitled divorce spouse. So it really depends whether you're currently married or not. So I didn't get canceled on my Advantage plan. Do I need to re-sign up for 2026? If you know 100% for sure your particular plan is the best plan in your area, that's going to save you the most money and get you the most benefits and everything, then you don't have to do anything. It automatically re-enrolls. But remember, don't compare what you have right now because that's not what you're going to have next year. All plans, all Medicare Advantage plans end, they terminate like Cinderella, whatever, December 31st. And then your plan is going to be switched to another plan starting 2026. It might have the same card and it's the same company, I'm sure, the same name on the card and the plan name and stuff like that. But health insurance companies every year can change all of the details, how much you pay for hospitals, how much you pay for this, how much you pay for the prescriptions and stuff. So I'm sure you had the best plan this year based on what was out there, but is your current plan the best one for next year? So if 100% and remember your company that you have it with, you're like, oh, I like this company. Okay, well, it's fine. Keep that company. But go to another plan because I guarantee you, the 99%, that your company has multiple plans in your area. So your plan, they might come out with a new, more shiny model for next year, but they don't want you to sign up for that new model. That's for new people. The people that are still on there, they want to make as much money on it, so they're going to keep you on that older plan. But this new shiny plan that they have, which they're not telling you about possibly, you can jump ship and get into that one, same company, or you can go to a different company. So I would definitely spend the, 10 or 20 minutes, call up Chapter, call up whoever you want and say, hey, check out all the 20, 30, 40, 50, 60 plans in my particular area and tell me whether my plan for next year is still the best plan for me. And if it is, then you don't have to do anything. You're done. So, you're not done. Then you move on to the 6th P, persistence. Then you make sure you get everything out of that. So, Let's see. I became disabled May 2024. I received my first disability payment 2025. I was told I received my back pay, but it won't be until January 2026 due to an error in calculation. Wow. Your first disability payment, August 2025. So it's been a couple of months. And yeah, normally you would have, everything would have been done by nowish, but the, the offices are very, very low in terms of staffing. So, I mean, I'd reach out to them and say, hey, it's nice y'all, fess up and say there's an error and thank you for working on it and stuff like that, but I need that money. So if you could expedite it, yeah, please expedite it. Usually those type of calculations, I'm not sure about your particular case, but usually those in SSDI, those type of calculations are done at the processing centers. And unfortunately, Elon Musk and Doge closed down most of the processing centers. So your case might have been in one of the processing centers they closed down, and now it's just in limbo trying to find another place for them to work it. So I would probably reach out to someone and say, hey, just make sure it didn't fall through the cracks. So it's not stuck in the mail somewhere. Timothy, I changed my SSDI to change a phone number. Now I can't get back into my SSA. Do I need to have it change my October 15th? So yeah, your SSDI. So you just wanted to change your address. You direct deposit and everything else the same. You're just changing your address. I'm sorry, you're just changing your phone number. So yeah, in order to get back there, yeah, you probably need to talk to a human being so they can unlock your account so you can get it all set up. So do I need to have it change my October 15th? I don't think that's a particular important date. Yeah, you just need to get it changed. Yeah. The most important thing, because Social Security really won't call you unless you've got something pending. But yeah, if you get called by Social Security, then it's a 99% chance it's not Social Security, unless you've got a pending claim and they're looking for documentation. But yeah, if your address is correct, then that's where they will send any information is to your address. But you need to get into your MySSA. So I would just reach out to them, call them right now. Well, can't call them right now, but anyway, call them and they should be able to set you up and unlock your account. So let's see here, kind of showing your colors with this video and stuff. Yeah, black today. So let's see here. Got through to person in Joplin, Missouri, Social Security office quickly. All right, so now we know. So as I always say, that's one of the tricks is all 1,200 plus offices in the country are your Social Security office. So if you call the 800 number, can't get through, or tired of talking to the artificial intelligence BS they got going on now, call your local office. You can't get in any office in the country, including the one in Joplin, Missouri. That is your Social Security office. When you call them, they might give you a hard time. This is not your office. And then what's my response? Does it say Social Security on the outside of your building? Yes, it does. Well, you are my office. So again, you can do that for any type of new business. But if you're looking to talk about an existing issue that is in your local office, then you should really contact your local office because someone in that particular office is probably working on it. So let's see. Let's go one more question here. Trying to find that person that disagreed with something I said. See if yeah, I guess I don't see anything there. I'm still working still. We both are 65 and my husband is retired and getting Social Security. I have him covered under my employer's insurance, but he is not using his Medicare. Can he be penalized? Nope, not at all. So you're both covered under your health insurance. You're currently working. You're getting health insurance from current work. It's not a retirement plan. You're currently working and receiving that health insurance. Your employer, that plan has 20 or more employees. You're good. So he technically can, if he's paying the $185, stop. Call Social Security and say, yeah, we messed up. We didn't know about the exception about current health insurance from work, and we don't want to pay the $185. So Mary, if you're going to continue working and still receive a health insurance for another 6 months, a year, 2 years, or something like that, save yourself the $185 and just go ahead and cancel it. Think about that. But Part A, you won't be able to cancel because that's zero premium anyway. And if you're receiving Social Security benefits, you have to have Part A. But B, if you don't need it, why pay for it? If you have a Medicare supplement plan, Medicare Advantage plan, then, obviously take all that into consideration. Maybe his continuing Part B and paying the $185 is still good because of maybe his, situation, and it provides the other extra coverage that your company is not, it's not great health insurance. So you need to take all those into consideration. But yeah, he doesn't have to have Part B. If he has health insurance from your current employment and then 20 more employees, he does not have to pay for the $185. So, but don't just stop paying the $185. You have to reach out to Social Security and tell them to cancel Part B. So yeah, if you just stop paying the $185, then everything else is going to get messed up. So, but thanks, Dr. Ed. Last year, Chapter helped me find a good PPO. I will call them again this year. All right, perfect, good deal. So I wonder if yours was one of the ones that was canceled, then you can check out a Medicare supplement plan. At least check it out to see if it's maybe something better for you. All right, this will be our last question. I don't think I've seen Terry here before. Hey, Terry, the key to all of this is persistence. Yes, the sixth one, exactly. I had a lot of issues signing up for Part B, but finally got an appointment to go in the office. Only a few people working, but they took care of me. Awesome. Good. So yeah, this is one of the big problems that we're going to see because of the low staffing. If you've got time and my health insurance from work is going to stop in a couple of months. So I've got a couple of months, I'll go ahead and start the process. But unfortunately, there's people that, they lose their job, their company shuts down, and it's towards the end of the month and they need to sign up for Part B, and it's got to be effective in the next week so they can get a Medicare supplement or Medicare Advantage plan or whatever. And Social Security employees just, there's not enough there to help you out. In that particular case, you got to go down to the local Social Security office and tell them it's a dire need. Talk to the security guard, the Federal Protective Services privately contracted security guard, and say, hey, this is a life or death issue. I just got laid off. I need my Part B to start immediately, in the next week or two. If I don't, I'm not going to be able to get my prescriptions. I've got a doctor's appointment, so you need to let me in so I can get this taken care of immediately. Don't do it online. You can do it online, but it might take a month or 2 months or 3 months. Don't call and schedule an appointment unless they can get you an appointment in the next day or something. Tell them that you got to have it. So yeah, persistence. Exactly. Persistence. So thank you, Dr. Ed. You're the best. And you are too, because y'all share all this information with everybody else. It's just me sitting here talking to however many thousands of people right now live, but y'all go out into the community and help other people. So you guys are awesome. All right, that'll do it for today. I'll be back again tomorrow. I'll come up with another topic, and then I'll do a live Q&A. So if you've got any friends or family that have any questions, bring them on in, and let's help them out as best as we can. And we'll see y'all tomorrow. And please, 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 please,